This video tells you what to expect during a stereotactic biopsy. This type of biopsy is done to take a small sample of tissue using a hollow needle. It is a procedure performed by a breast radiologist who is a doctor that specializes in breast imaging. When you mark the biopsy date in your calendar, it is a great time to arrange for someone to pick you up after your biopsy to get you home safely. Depending on what medicines you are taking and whether you have an allergy to numbing medicine, you may need to see your referring doctor. You may want to take a shower the night before your biopsy, as the biopsy site will need to be dry for 24 hours. Avoid using lotion, deodorant, or any scented products around your breast or underarm, as they can affect the quality of the imaging. You can eat and drink normally on the day of your biopsy. Wear comfortable clothes that are easy to put on and take off. Remember to bring your health card and your blue hospital card. If you do not have one, the breast imaging receptionist can give you one. Arrive 15 minutes before your appointment time. When you come in for your appointment, you will change into a gown and then meet your nurse practitioner. They will explain the procedure and answer any questions you may have. Then you will meet with the radiologist and the technologist who will perform the biopsy. The radiologist will use a special mammogram machine to find the biopsy area. You will lie face down with the breast positioned in an opening in the table. The breast is then compressed with 2 paddles and several images are taken. Before taking the sample, the radiologist will give you a needle with numbing medicine to numb the area. A small cut is made and the needle is inserted a few times to collect tissue samples. The needle makes a clicking sound each time a sample is taken. You may feel some pressure during the biopsy, but should not feel pain. If you do feel pain, be sure to let the radiologist know, as you may need more numbing medicine. Once the tissue sample has been taken, a small marker may be placed into the biopsy site. This marker is then used to locate the site if there is a need for any follow-up treatments or procedures. If you had a marker placed, you will get a mammogram after the biopsy. After the samples are collected, a dressing will be applied over the cut, and you will be given information on how to care for the area. When you go home, wear a bra for support. Keep the biopsy site dry for 24 hours. If you have bruising or discomfort in your breast, apply an ice pack wrapped in a clean cloth for 20 minutes. Repeat once every hour as needed until bedtime. If you need to take something for the discomfort or pain, take acetaminophen. Do not take acetylsalicylic acid or ibuprofen, such as aspirin or Advil, because they can cause more bruising. If your skin is irritated, you can take off the top dressing a few hours after the biopsy, but do not take off the steri strips under the dressing. These will fall off on their own in about a week. If they do not fall off after 7 days, you can take them off. You can return to your normal activities, but avoid lifting heavy things such as groceries or doing very active things such as playing sports for 1 to 2 days after your biopsy. While a breast biopsy is a very safe procedure, there is a very small risk of bleeding or infection. Call your family doctor if you notice a fever higher than 38 degrees Celsius, a lot of bleeding, redness, increased swelling, and/or pus at the biopsy site. It is common to have feelings of anxiety or worry during this process, and there are many supports available to help you during this time. These include your healthcare team at the Gattuso Rapid Diagnostic Centre, the Survivorship Centre, your family doctor, and the Princess Margaret Patient and Family Library, where you can find trusted health information. For detailed information about how you need to prepare, go to the Gattuso Rapid Diagnostic Centre website or pick up the Stereotactic biopsy pamphlet at the Princess Margaret Patient and Family Library in the main lobby.